And hi, Jen. Good morning. My name is Svetlana. I will do head-to-toe assessment today. Is it okay with you?
Yes.
By walking in the room, I assess my patient for ABC sounds. Her airway, breathing, circulation is normal. Her skin color is appropriate. I don't see any bluish or jaundice or pallor or arrhythmia. Then I will ask my patient a few questions. Could you tell me your name and date of birth, please?
My name is Carmen Lacunza. My date of birth is August 29th, 1983.
Could you tell me where you are?
Harper College.
Could you tell me the day of the week?
It's Monday.
Could you tell me who's the president?
Trump.
By asking these questions, I assess my patient cognitive function, her level of consciousness, and she's oriented ×4 to the person, place, time, and situation. Her behavior is appropriate, her speech is clear, and also before going to the room, I took her vital signs. Her blood pressure is 125/75, her pulse is 75, her respiratory rate is 20, and her temperature is 97.5. Also, I know her height is 5 feet and her weight is 135, so her BMI is 26. Now I will go ahead and I will do my head assessment. I look at her head, it's symmetrical, appropriate size for her, so I will record it as a normal cephalic. Then I look at her scalp and assess for any lumps, for any lesions or anything abnormalities, and then I'll palpate it for any lumps, masses, or tenderness. Also look at her hair, color, distribution, the texture, and then check for infestations by stripe them my fingers through her hair. I look at her cranial nerve number 7, which for symmetry. I check for stroke or Bell palsy. Ask my patient, could you smile for me, please? Could you frown for me? And I don't see nothing is drooping. I will assess her for sinuses, the frontal sinus on the lobe, then maxillary sinus over the cheeks. When I do that, she should not feel any pain or tenderness. She should just feel the pressure. And then I'll assess her temporomandibular joint. Can you open your mouth, please? And close. And I assess for crepitation or any tenderness. Then I put a Sheldon chart 20 feet away from the patient. Ask her to close her one eye and read from the chart the letters. So then I will assess her cranial nerve number 3, 4, and 6. I will perform a diagnostic test with the 6 Gauss position. Could you look at me, please? And follow my pen. And then accommodation test for the ability to see the closed subject, and then I perform my test for the pupil reflex. By that, I'm gonna close one eye, and slowly, okay, on the other side. So her pupil is 2 millimeters, and I will record as parallel pupil equal round react to light and accommodate. Then I look at her sclera, which is white, and I look at conjunctiva, which I should see the vessels. Then I look at her, I will inspect her ears. I will look at them first of all for any lesions, for color, for inflammation. Then I will palpate them for any lumps, masses, or pain. Then I assess for ceruleum, auditory canal, and then I will check your cranial. I'll do for both ears the same, and then I'll check your cranial nerve number 8. I will say something and you repeat it to me, please. Harper College.
Harper College. President.
So her cranial nerve number 8 is intact. Now I'm gonna look symmetry of her nose. I will look for inflammation or lesions, color, and then I palpate for any lumps or masses. I look at the septum deviation, which is symmetrical. And then I'll ask to, can you close one nose for me, one nostril? I will look nostril patency and breathe it in and the same. Okay, everything is good. Now I can move forward and perform my mouth and throat assessment. I'm looking at her lips, they shine, moist. I don't see any crackles, the color is appropriate. Now can you open for me your mouth, please? I look at the teeth, absence or presence of the teeth. I look at the gum. The gum is tight. Then I look at the mucal mucosa, which is pink. I don't see any inflammation. Then I look at the hard and soft palate on the top, which is pink. Right away I see uvula projection, which is pink. I don't see any inflammation. And I assess her for the tonsils, which I record +2. They're not inflamed, and I don't see any exudate. Then I'll look at the dorsal surface of the tongue, which is nice, moist pink, and the ventral surface of the tongue, which is the back of the tongue, where the veins are located. I look at the floor of the tongue, where usually cancer forming, and I will check my patient gag reflex by checking cranial nerve number 9 and 10. Could you tell me and I see how soft palate and uvula rises. Okay. So then I will go ahead and start to do my neck assessment. I will check your inflammation of the glands, which are parotid glands of the cheeks. Then we have thyroid gland, the back of the base of the neck. I don't see any inflammation, so parotid and parotid, and salivary glands over here. So I don't see any inflammation. Then I will check for the lymph nodes. The lymph nodes, I palpate for lumps, masses, and inflammation. I will palpate for preauricular lymph node, postauricular, occipital, jugular digastric, the corners, submental, submandibular, superficial cervical, and then deep cervical. It's like way. And then posterior cervical. And then can you shrug your shoulders for me, please? I'm assessing subclavicular lymph nodes. Then I check your resistance. Can you turn your face? Okay, turn this side. Then I will check the range of motions of the neck. Can you back up, tilt back? Can you turn side to side? Ear to shoulders and to your chest. Okay, the range of motions is good, and I can palpate your from S1 to S7 for any lumps, masses, heat, or tenderness, and I always inspect. Okay. And can you shrug your shoulders? Okay, that's it. I checked cranial nerve number 11, and can you stick out your tongue for me, please? I check in symmetry of the tongue, and I check my cranial nerve number 12. Now I will perform my upper extremity assessment. Always when I'm performing assessment for the joints, I inspect for shape, swelling, and size, and I palpate for heat, tenderness, lumps, or masses. So I will inspect your upper extremities. The color is appropriate. I do my temperature. Okay, I don't see any lesions, any inflammation. Then I palpate her shoulders, I palpate her elbows, I palpate each finger, especially it's a lot of bones here, so I have to do really good palpation. Let me put my gloves on. And I check your radial pulses. They are strong, and I document as them +2. Okay, radial pulses. Then we'll do range of motion with my patient for the shoulders. can you swing your hands up? Okay, put them back behind. Okay, then put them down, and then do like that. Okay, then give me your hands. Now I'm assess them. Do like that. This and that. Okay. I look at the elbows. Now, just can you do up and down? Just fingers. Okay. Can you open fingers and close? Okay. Now, can you grab my hand? Okay. And can you push me? Pull. Push. Okay. Pull. Push. Her strength is good. I checked my shoulders for strength. I don't see any edema also, and then I will check her capillary refill. For each finger it's brisk, less than 2 seconds, and I also check your profile sign, which is should be less than 160 degrees. The same here, each finger, capillary refill, profile sign, less than 160 degrees. Then I would like to come back and to do my carotid artery. I check carotid artery one at a time, okay, and it's strong. I can hear pulsations, +2, and I will listen with my bell of the stethoscope. I ask my patient, can you take a deep breath in? Can you take a deep breath in? Out? And can you hold for me, please? And now I will listen carotid artery. I'm listening for any bruise, which I don't hear. I don't hear anything. It's clear and strong. Okay, so I did my upper extremities. Now I will do the breathing. I will check when I'm walking. I checked already my ABC. I checked the color. It's the first when we do lung assessment. That's very important. I see that my patient breathing is rate, depth, and rhythm is regular. She doesn't use accessory muscles, and I don't see any bulging on interspaces. I see her breathing is symmetrical, and in the back, I also check the symmetry of the breathing. Can you take a deep breath in? Take a deep breath in and out, and I see how my fingers are going up and down. Then from the lateral side, I look at the transverse ratio, 1:2 should be, and then I have to palpate, always palpate. I'm sorry, I have cold fingers. I have to palpate for any lumps, masses, on tenderness, all her chest. All her chest, I'll do my palpations. And then I will listen for the bronchial sounds, bronchivesicular and vesicular sounds. The bronchial sounds, they are located on the neck, here and here, and the manubrium, and they are high pitch. The bronchiovesicular sounds are located close to major organs over here, and the same between the scapula here, and they are mixed sounds. And then vesicular sounds are located all over the lungs, like here and here. And when I listen 5 locations at front, 9 positions at front. Right side I listen for 3 lobes, as we have 3 locations, 3 spots, and left side I will listen for 2 spots. I will ask my patient, can you take a deep breath through your mouth, deeper than usual you do, and I will perform my listening. Okay, take a deep breath in. Take a deep breath in through your mouth. Okay. Take a deep breath in. 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 Take a deep breath. And I do like symmetrical, so from here side to side, then again side to side, and then again down, and then again. And I will do 3 positions here. Take a deep breath in, take a deep breath in, Okay, and 2 here. Take a deep breath in. Take a deep breath in. Okay, her lungs are clear. I don't see any wheezing. So now we can move forward to our heart and neck heart assessment. So I'll ask my patient to lay down for the heart assessment. I will check your jugular veins for heart assessment, which the head should be elevated 35-40 degrees, and I'm looking for the jugular veins here. Can you turn to the left? Okay, they're flat. Then turn to the right. Okay, they're not inflamed. They're flat, which is appropriate for her. And then you can sit down for me, please. I will go ahead and I will check. I don't see any pulsations here from her heart. I will her heart rate is normal, and I will go ahead and find her apical pulse, which is gonna be here. 2 fingers. I use my 2 fingers. I find it, and then I listen apical pulse for the full minute. Okay, I'm gonna listen it. Okay, her apical pulse is, I can hear left up. I'm hearing S1, S2. I don't hear any extra sounds, and I don't hear any murmurs. So I checked her, and it's located under the chest, right, the center, like 5th intercostal. Now I'm gonna listen her valves. We have aortic valve. We have, which is, I will all valves I will listen with the diaphragm and the bell. When I'm listening all valves, I should listen in for the extra sounds. I should hear only S1, S2. I should not hear any S3, S4, or any murmurs or any other extra sounds. So I will check the diaphragm. I will listen for the aortic valve, which is 2nd intercostal. Then next to that is pulmonic valve, 2nd intercostal. Then next to pulmonic, I will go to the tricuspid valve, like 5th intercostal. And then mitral valve is gonna be mid-clavicular line and 5th intercostal. I'll listen with bell also. Aortic, pulmonic, tricuspid, and tricuspid. Okay. So now, so I don't hear any pulsation. Everything is clear. Her heart rate is regular. Now we'll go ahead and do my abdomen assessment. Can you lay down for me, please? When I walk in, I look at the contour of the abdomen. It's nice and flat. Then I look at the symmetry of the abdomen. Okay, the symmetry, it's symmetrical. Then I come to the abdomen, I inspect it. I inspect for color. The color is appropriate. I expect any operation scars or any maculas. So I do complete inspection. I check the temperature, then I expect your umbilical. If it has piercing, I should document because it's risk for infections. And I can see aortic pulsation for the abdomen, which is considered normal, 2 inches above. Then always I have to look and then I listen for the 4 quadrants of the abdomen. I prefer, it's better to start with the right upper quadrant, but it's not necessary. You can see you can listen any quadrants. When I listen in for the quadrants, I will hear hypo or hyperactive sounds or normal sounds. Okay, I'll listen like 4 quadrants. Okay, she has a normal sounds of peristalsis. If I don't hear anything, I have to listen each quadrant for 5 minutes. Then I listen for the renal artery and for the iliac renal artery and for aortic pulsations. Aortic artery, aortic artery 2 inches above the umbilical, and renal artery is going to be 2 inches parallel to aortic artery. Okay. I don't hear any murmurs. The sound is clear. And now I'll ask my patient, do you have any pain in abdomen?
No.
So I will do my palpation. I will do, first of all, I do light palpation, which is going to be like 1 centimeter with rotary motion with pads on my fingers. So it should be soft, nice, no tenderness or pain. And then I'll do deep palpation, which is going to be 5 to 8 centimeters. Deep palpation. Do you feel any pain?
No.
Okay. I check any inflammation of the organs with the deep palpations. Okay, now you can, actually it's fine, you can lay. I'm gonna do my lower extremity assessment. For always I have to palpate first and look at the hips. I will do my assessment for the hips, knees, and ankles and feet. So I palpate her feet, hips for any pain, tenderness. I inspect them as I said before. So I palpate her knees. Now I look for edema. Palpate for edema. I found the pedal pulses are here. I look profile sign for each finger is less 160 degrees. I inspect for capillary refill. Okay, capillary refills. Less than 2 seconds. Brisk pulses I will document as +2, nice and strong. I check the temperature for her feet. It's nice and warm. It's the same as her hands. Nice and warm. She doesn't have any signs of edema. A profile, okay. And also I always assess the skin thickness. The skin should be nice, shine, and thin, except the heels and the hands, the palms. So I should do really good assessment of palpation at the feet because they have a lot of small bones. When I'm palpating, I should really good assessment. And now I will check her range of motions of her feet. Can you touch your finger to finger for me, please? Okay, now can you touch your heel to heel? Okay, heel and finger to finger. Okay. Can you bend your knees? Okay. And then can you push me? Pull and push. Okay. Range of motion is good. Now we'll check your legs range of motion. Can you abduct your leg feet? Okay. Can you up? And can you hold it for 5 seconds, please? Okay. Can you hold the other for 5 seconds? To the side, abduct, adduct. Can you touch your knee, touch the chest? Okay. The other. Okay. And then can you pick up your both feet and turn to the side? Okay. And the other way. Your range of motion is good. And then can you push me? Pull. Okay. Pull. Good. Can you sit down for me, please? Or while she's laying down, actually, I'll check her Babinski reflex right away. So her Babinski reflex from the heel. Okay, I see her toes are curling, which are negative Babinski reflex, which should be, that's what we should see. I should not see any fan. The same the other side. Okay, she's ticklish. Now you can sit down for me. I forgot to check your hands. Can you do your hands like that for strength and hold them for 10 seconds? Okay, good. Now I'm gonna go ahead and do knee range of motion. Can you up, here, down, up, and down? Okay. Can you stand up for me? You can hold the bed and just like that. Okay. And your range of motion on the knees is good. You can sit. So I checked your pedal pulses, edema, radial pulse is good. Now I will perform my neurologic assessment of my patient. I will start from sensation. Can you close your eyes, please? And can you tell me when you feel it?
No. 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 No.
Okay, and now I will do sharp or dull discrimination. Can you open your eyes? This is sharp and this is dull. Okay, now close your eyes.
Sharp. Dull. Sharp. Dull. Sharp. 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 Sharp.
Now I will perform, you can open your eyes. Now I will perform stereogenesis test, which is, I'll give you something to your hands, you close your eyes please, and you're going to tell me what's that.
Cotton ball.
Okay. Now I will check your cerebellar function. That's, can you put your hands, okay? And can you move each finger on your hand, okay? Now just move each finger like that, okay? Can you touch pad to pad, which pad to pad, okay? Now you look at me and you touch your finger or touch your nose and then touch my finger as fast as you can. The other hand. Okay, now can you stand up for me please? Can you do shin to heel to shin please? Shin to heel? No, shin to heel.
Oh. Sorry.
Okay. And now you can walk, I will look at your balance please. And your big toe touch the heel. The big toes touch the heel. Okay. Touch the heel. Your balance is appropriate. And now I will assess for the Romberg test. Can you close your eyes and I will count for 20 seconds. I put my hands like that just in case if the patient will lose the balance. Okay, Romberg test is appropriate. You can take a seat, please. Now I will check your tendon reflexes. I'll check Babinski reflex. Now I will check the quadriceps reflex. I'll find the patella, and I'll hit the patella. Okay, the patient is okay. Good. And now I will check your quadriceps. I check, and now I will check your biceps reflex. So can move. Okay, I will need to find the tendon. Can you flex it? Okay, and then your tendon is here. I'll hit my finger. Can you relax? Flex. And your hands are curling inside. And I do the same the other side. Can you? Okay? Okay. Good. Okay. I check the temperature, I look at the color, symmetry. Now, can you stand up for me, please? I will check your cervical, your spine. We can turn to that side. I will palpate each. First of all, I always inspect. I look at the color, I look at the lesions, I look at the macules, I document everything. Then I palpate each cervical for any lumps, masses, tenderness, or heat. I look at your spine. It should be like an S. I should see concave, curvature, and lumbar. Then I check for the symmetry. I look at the shoulders, equal, scapulas, gluteal folds, and hips. They should be symmetrical. Then I will check your cervical, the strength of your cervical spine. Can you bend and touch your knees, foot, please? Can you bend? Okay, that's good. And then she do this. I should see like a little bit rounded here, and she should not feel any pain. Also, I will check your strength by saying, can you turn side to side, that side to that side, but not moving your hips. Okay? Okay, good. And can you do like okay, this side and that side. So that is for cervical spine. I check the symmetry. You can take a seat, please. That's included. That's all for our head to toe assessment today.